Hello, it's a great pleasure to be here with you today. My name is Pradeep Nair. I want to thank Dr. Walker, NCVH, for hosting this digital education series during these tough times we're all living in. Today, what I'm going to be speaking on is the AMStent system. It's a regenerative stent technology. Here are my disclosures. So, one of the first challenges that we face as interventionalists is the process that occurs after implanting stents, which are foreign bodies. All foreign bodies elicit some form of a reaction, whether it be with the concern over death, with paclitaxel, amputation risk as a result of these foreign bodies, restenosis with stents, formation of scar tissue, infection, inflammation, reactions such as scarring and allergies, thrombosis, and of course, migration. These are all concerns with all of the types of foreign bodies that we as interventionalists implant. One of the concepts that aims to tackle what these foreign bodies elicit is amnion. So amnion is a thin, tough, transparent, acellular collagenous membrane that protects the fetus in utero. The amniotic fluid and membrane have established clinical applications, with roughly 10,000 research articles published on amnion since 1904. So why is amnion a consideration for us to treat in interventions? Well, it's a proven biomaterial that promotes healing. It has almost a century or more of clinical history, with a growing list of applications such as wound and burn management, its use in ocular tissue reconstruction, spine surgery, adhesion barriers, and reconstructive and plastic surgery. One of the great value and benefits for amnion is its favorable biological properties and safety profiles. It really supports natural endothelialization and the regeneration of healthy tissue. It allows for an anti-inflammatory, antimicrobial, antifibrotic, and antithrombotic property, which helps in the healing process. So in commercial and clinical performance, it has been shown to be one of the best-in-class biomaterials. It's been used in ankle wounds for severe traumas, in which wounds can heal in 7 weeks. You can see in the top right corner of the slide. It's been used in corneal erosions, with complete healing noted after 3 days. In diabetic foot ulcers, podiatrists specifically have been using this to heal diabetic foot wounds. And in the in the arena of dentistry, it's been used for treating gingival recession defects. So here are some characteristics that we talked about. So one of the facts is that the human amnion has the ability to provide anti-inflammatory effects. It provides a tryptophan desert in which amino acids are depleted and inhibits lymphocyte proliferation. It also has antithrombotic effects. Specific for endovascular intervention is something that can really thwart our good results when we treat patients with peripheral artery disease. It has pro-apoptosis effects. It's non-tumorigenic, it's compliant and durable, and quite frankly, it's readily available. There are 4 million live births in the United States yearly. It has been studied in various vascular applications to date. Most of them have been animal clinical trials in which it's been used as an interposition graft in carotid arteries. The one human study looked at its utilization in cardiac surgery, in which patch placement of amnion were placed, and it's shown to elicit anti-inflammatory effects. But in the animal study specifically, this is where most of its valued benefits have been shown. So it holds promise because of its ability to not elicit an immune response or rejection, provide anti-inflammatory effects, which can help reduce your chance for rejection. It has an antimicrobial effect to reduce the risk of infection, and also can enhance long-term patency by reducing fibrosis and scarring. And finally, as we've mentioned, the anti-thrombotic effects, which can plague our interventional procedures. So when we look at its preclinical benefits thus far, it has shown luminal healing, patency, durability and compliance, as well as immunosuppression. This is how the AMStent and amnion patches, as well as the amniotic fluid, is procured. So after a baby is delivered, the placental tissues that arrive to the tissue bank are processed under stringent conditions. There is very strict microbiological and viral testing of donor tissue and blood performed. And from here, the AMStent is created, as well as the patch and the fluid. The AMStent has an envelope of amnion, both on the inner and outer layer of the stent itself. And this is a self-expanding stent. To date, the amnion AMStent design and verification has been tested in over 70 key preclinical tests involving 81 animals and 4 species. The results have been submitted to the FDA and are currently under review, where we will formally gain some insight into further clinical trials in the not so distant future. When we look at the initial preclinical studies involving AMStent, it has looked at ovine or sheep trachea, as well as sheep iliofemoral implants. So in the trachea, it looked at these sheep out to 30 days and 21 days in the sheep's iliofemoral segment. Looking at the tracheal implant, that there was a chronic 30-day non-GLP study to assess anti-inflammatory and antimicrobial properties of the tracheobronchial stents in the healthy ovine. And 2 sheep were utilized for this study. And what they found is that in gross examination, the tracheal lumens were widely patent. There was full incorporation of the stents into the tracheal wall, and there was only mild mucosal thickening. What is phenomenal with these stent implants is that all sections of the amnion-covered stent had high levels of epithelialization, roughly 90 to 100%. And there was some variability in the type of epithelialization that occurred between ciliated and non-ciliated, as well as squamous epithelium. In one of the sheep, there was a high amount of ciliated epithelium. In the other one, it was quite variable. But there was only minute or very small areas of epithelial erosion that was noted, and this was related to be from active neutrophil infiltration. If you look at the histopathology, what is astonishing is that ciliated epithelium was able to regenerate after implantation of these stents with very minimal inflammation around the strut. If you look at the overall findings from the sheep model, it has shown anti-inflammatory effects. There were no infections or granuloma formations, and there was quick healing at 28 days. The stents were fully patent. You had working ciliated epithelial cells with a functional mucociliary escalator, and it was fully biointegrated into the trachea. And this is what it looks like as far as a radiograph is concerned. And what we see is that there was no stent migration noted. So the initial endovascular proof of feasibility with the AMStent was evaluated in, again, an ovine model in iliofemoral arteries using the amnion-covered, enveloped, self-expanding alloy stent. Essentially, very promising findings were noted. There was no thrombus or scar tissue. These stents healed and were fully biointegrated. They re-endothelialized, and the amnion served as a barrier to infiltrating neutrophils, which can predispose us to restenosis. There was no infection and no device migration. So in summary, amnion covering offers the potential for an improved biological response to facilitate improved patient quality of life. The initial animal work demonstrated the intraluminal healing characteristics of amnion. This concept is significantly promising as a new approach to intraluminal healing. And the next steps will be ongoing clinical research. The FDA submission is ongoing, and results should be received very soon. And the first in human clinical trials will then be planned. And with that, I thank you for your attention.